Hello, everybody. My name is Ryo. I'm the technical lead from Ascending and an advanced tier AWS partner. Today, we will showcase the transformative capability of AWS Gen AI in the healthcare industry. In the second part of the webinar, our chief data scientist, Jon, will present an open demo built using AWS Bedrock and other AWS services. You can find a demo URL in the description below. It's crucial to implement Gen AI with healthcare compliance in mind. Without further ado, please enjoy the recording.
To today's webinar. And as you can see on the slide, today is all about LLM and healthcare and how we can use LLM in healthcare in a way that not introduce additional work to the doctors, but get their buy-in so that we can push this amazing technology in the industry that we need it the most, which is healthcare. I'm sure some of you have, I'm sure all of you are working in the healthcare space and are aware of the challenges and opportunity in this space. And LLM, I believe it has reset the entire software development completely. And actually, the way how we design the computer going forward will be completely different because deep learning, LLM, and NLP, natural language processing, is no longer a single chip problem. So the way how you design the computer has to be completely different. So this technology has really reset the software development and the existing fleet of tons of servers, switches that we have developed in the last 30 years. It reset all of that. So we're on the new horizon and new playground, everybody at the same ground level, and someone who can take advantage of this new technology and apply it to the industry, in this case is healthcare, will win the most. If you think about it, the traditional software development and computer is basically a information retrieval system, right? If you think about it, if you pull out your phone, you type in Google search, or you check Facebook, it basically some electron going to some data center somewhere on the surface of the earth and get the information back for you. And you can see that on your phone, on your computer screen, on your TV screen, whatever, we have you. So based on what Jensen Huang, the CEO of NVIDIA, has mentioned in the DealBook Summit conference not too long ago, and he believes in the future, the compute will be a combination of retrieval and generation. So LLM give you a sneak peek into that future that we're heading towards. Okay, so with that said, let's dig into today's content. And we as an engineer, I'm talking about myself, I have an engineering background. I'm now fully dedicated in the healthcare space. I work with doctors, physicians, nurse practitioners, physician assistant, medical staff, medical system a lot every day. So I'm fortunate enough to witness firsthand how inefficient our healthcare system is really. It's really, really inefficient, and how technology can help. And I used to work for IBM Research in the IBM Watson lab. I witnessed firsthand how IBM Watson went downhill, for the lack of better word. One of the mistakes I learned, one of the lessons I learned during my IBM days was as soon as the product team or the management, let the engineers to dictate the direction of the healthcare product, that's a recipe for disaster. I should learn from the history. IBM is a good example of that. So I want to start today's conversation with what clinicians say about AI. And let me be clear, most of the physicians and doctors and nurse practitioners, they don't really care about AI. They don't know about AI, and most of them, unfortunately, they don't want to know about AI, period. These two amazing individuals you see on the screen, Dr. Graham Walker and Dr. Joshua Yuan, they're one of the few exceptions. They are both. So Dr. Walker is a ER physician. So he specialized in emergency medicine. He's currently working in the ER in California. And Dr. Jon, he's based in UK. He's the host of DevDoc podcast, and he's very enthusiastic about AI, and he's a neurosurgeon. So this is what they say about AI. And you can see there's a common theme here. And this is also very consistent with what I read about the big hospital is doing with this technology. Is they don't really want to get into the high risk area where we use AI for diagnoses, we use AI for decision making. It's very high risk because if there's no physician oversight, AI made a mistake, whose fault is that? So it can get very complicated very quickly. So most of the healthcare organization in US and in Europe and UK, and they want to have a virtual admin, a virtual clerk that can deal with administrative side of the thing. Okay, so those things are very robotic, and AI and machine can do very well. So let's read what Dr. Walker has said. He says we don't really need AI for most diagnoses, obviously, because medical training is very, very good, and most diagnoses are very common. I hear that from my urgent care provider as well, and they sometimes tell me, John, I can only see so many runny nose a day. And to the most of the urgent care doctors, they really want to deal with more complicated cases so that they can flex their professional muscle, so to speak. But unfortunately, I think most of the patients coming in, they're for COVID, they're for headache, for very common diseases, and it's so repetitive to the point that, and the doctor that I speak to, urgent care, they want to use a template so that they don't have to fill out the same chart notes over and over again for patient with the same symptoms. So this is where AI really shine. I'll tell you about that in a minute. So Dr. Walker's point is, well, we don't need AI for diagnoses, right? And we don't really need that. And to build on top of that, and Dr. Jon also said that, can we just focus on the administrative task before we jump into clinical decision making? And actually, administrative tasks are lower hanging fruit. But if you think about AI in healthcare, I don't know about you, but for me, the most exciting thing is, well, AI doctor, right? That's the most obvious thing. Well, can AI replace doctor? In my opinion, and most of the doctors I speak to, including those two individuals, they don't think the AI doctor will be here anytime soon. At least AI's job is not to replace human doctor, and AI should be a co-pilot for the doctors. And we've seen this concept very, very frequently now in other industry, right? So we have Copilot on in Microsoft product suite, and there are tons of Copilot for other industries. So why can't we just have a Copilot for the doctors so that they can bounce ideas with this virtual advisor, virtual colleagues, and that can detect mistakes that doctor has made and make suggestions and provide more administrative support. Now, when I first mentioned this idea to a lot of other folks that I speak to that are in the tech industry, and they're not necessarily know too much about healthcare, and when I say administrative tasks, they think about scheduling meetings, phone calls, or paperwork automation, some kind of automation for paperwork. And actually, administrative tasks in healthcare go far beyond those two basic use cases. What we're going to demonstrate today is one of those two use cases, which is clinical note summarization. And there are a lot of tools out there for this particular use cases. I believe this is the most, I think this is the easiest entry point for tech to make an impact in healthcare without getting to the high-risk clinical decision use cases. And there are other use cases where AI can help entity recognition and extract medical concept. And there's an open source library called MedCat, and I've linked in the slide below so you can take a look. Okay, right now, without further ado, let's get into the demo. Here is the demo site that we created at Ascending. Now you can play around with it. You will have the link to it. And so basically this is a chatbot, but it is fine-tuned based on healthcare data. Okay. So what I'm going to simulate in this case is a patient-doctor conversation. Just imagine we have a laptop with this page opened in a browser, and it's listening to the patient-doctor conversation, record the whole thing, and I'm pretending I'm the doctor once the patient is discharged, and I've got this transcript of that conversation so that I don't have to memorize every little details when I was speaking with a patient. And for doctors, it's actually very good for their mental well-being because they don't have to jot down everything that they have heard from the patient when they were talking to the patient. They can actually pay attention to the patient, be present, and show empathy and capture more little details that matter to the patient during those conversations. So AI can take the notes for them so that they can finish the charts quickly. Okay, so I have this transcript. What I do is I hit the send button. It will send the entire transcript to our API. And after about 30 to 40 seconds, I'll get back a SOAP note, right? We've got subjective, objective, assessment, and plan. So ideally, these information will be sent directly to the EHR or the EMR that the clinicians are using so that they don't have to type anything in their chart. They can just review and make minor changes and close the chart, right? So this is definitely good news for the administrator because as soon as the clinician close the chart, they can start billing process. So that helps the revenue cycle management. So the owner of the business will definitely be happy about that. And for the doctors, they can finish their charts before they wrap up their day, so they don't have to bring the work to their home. So they can finish their work on time, finish their day on time, and this is a win-win for a lot of people. Actually, it's good for healthcare, for insurance company as well, because AI will be able to capture a lot of nuance in the conversation, and the medical notes will be more detailed. It actually helps if this chart ever gets audited in the future, we have more information in this note because all the conversation detail is captured. So I can ask follow-up question. For example, I say, this is good. Can you, let me hit the microphone. Give me a detailed HPI. So I can ask follow-up questions, right? I can make adjustment to the notes that I have received above. Okay, so here you go. Oh, I gotta shut off my microphone. So I've got the detailed HPI. So this is very helpful. And another thing that's very helpful is the assessment and the plan. I can say, give me a detailed assessment and plan, and don't provide any diagnostic conclusion. Just use my observation as is. Okay. So as you can see, this workflow is very smooth for doctors, and they can use this tool for completing their charts quickly. And based on my experience working with primary care doctors and urgent care doctors, they really like this tool because they don't have to. Most of the doctor I speak with, I work with, they're relatively senior. They're in their 60s, so they don't really like to type on the keyboard. So this way they can interact with their node charts using microphone. They love that. And also for billing team, I can even ask AI to generate the ICD-10 code for me. Give me ICD-10 codes. It works pretty good, right? In this case, so you get the idea. You get the idea here. Let me give you another real example. Okay, so I'm gonna let's say the patient does not allow me to record a conversation and they don't feel comfortable doing that. Well, that's fine as well. So as soon as they walked out of the facility, I'm working on my notes. I can just say a 65-year-old female patient present to the clinic with a chief complaint of progressively worsening left-sided abdominal pain that has been present for the past 3 days. The pain is consistent, non-radiating, and described as a dull ache. It is worsened by movement and alleviated by rest. The patient reports experiencing associated nausea and vomiting, and as well as decreased appetite and unintentional weight loss of 10 pounds or more over the past months. She also mentioned that she has been experiencing fatigue and weakness and has also noted dark urine and light-colored stools. The patient has a medical history of hypertension and type 2 diabetes and take lisinopril and metformin daily. He does not report any recent travel or sick contacts and denies the use of tobacco, alcohol, and illicit substances. On physical examination, the patient appears pale and in distress. Her abdomen is tender and palpation in the left lower quadrant. And the bowel sounds hyperactive. The remainder of the examination is unremarkable. Based on the patient's symptoms and physical examination, the working diagnosis is acute appendicitis, and the patient is scheduled for further evaluation with laboratory tests and imaging study. Okay, now I've got the entire recording. Let me just send it to. So as you can see here, as a doctor, I don't have to type, and I can just speak my thoughts into the microphone, and the AI can correct the spelling and fix the punctuation and give me a structured SOAP notes that I can work with. That's a great starting point. Okay, hopefully this demo will give you some idea how generative AI can be applied in healthcare. And this is not providing any diagnosis at all. This has physician oversight because the physician has to review what the AI has generated and put that into their chart. So this way we don't have to deal with the regulatory, the high risk, right? We don't have to deal with the high risk aspect of this this software. And last but not least, I want to touch up on another use case that I think it's very interesting, and I think this is another growth area for AI. And so this study is provided by Hippocratic AI LLM. So I've linked the paper in this slide. You can take a look after this call. Basically, what this study is saying is AI is extremely capable of doing follow-up calls for patients that has relatively mild symptoms, and for conversation like if patient has a heart failure before, and usually the mid-levels has responsibility to do a routine call to the patient to do assessment. So it's very routine, like verifying patient's identity, first, last name, and date of birth, and ask them, have you got enough rest? Do you drink water? And do you have any dry cough? Are you taking medicine? Are you weighing yourself regularly? So it's very, very routine checklist. So it's very robotic, right? So in this study, they find that AI can show a lot of empathy and has a lot of patience than human. And AI also has perfect memory. So for a lot of the respondents that interacted with AI, they actually rated AI highest on the list regarding the question of, do you feel the AI listen to you? Do you feel AI, the other party, I should not say AI because the respondent doesn't know if the other party is AI or not. Do you feel the other party care about you? Do you feel the other party listen to you? So AI ranked very high, if not on the first place on those categories. So I believe this is another area where AI can be really, really useful. It's again, this is an administrative task. This is not providing any diagnostic, and this is helping the healthcare organization to lower their staffing cost, right? And this is really not AI robbing humans' job. It's human can do some other things and let AI to deal with those mundane and robotic routines, and I think that's the way to go. That's the way to go, and that is about it for today's webinar. And thank you very much for your time. And if you have any question, please feel free to reach out to us at Ascending, and we will be happy to help on anything data, AI, and related, AWS related. And I'm the healthcare lead here. I'm the chief healthcare officer, quote unquote, at Ascending. So if you have any question, please reach out to me directly. And my name is Jon Roosevelt, and thank you very much for your time.